All right, can folks hear me? All right, we'll go ahead and get started. Work sessions are an opportunity. Work sessions are an opportunity for board members to discuss issues informally with staff and invited guests. The board encourages members of the public to attend work sessions and listen to the discussion, but there's generally no opportunity for public comment. Members of the public wishing to address the board are welcome to do so during the board's regularly scheduled meetings held twice monthly. So we have 3 items on the agenda. We'll start with the agenda review. We have Commissioner Thompson.
Well, thank you, sir. I noticed that the interviews for the Planning Commission are scheduled for a time when I'm away doing LCDC business. I understand that we had a lot of good applicants. There is an applicant from District 5 who has applied. I can't be there to speak for that person, but remembering that District 5 is over half the landmass of the county, I'd like to urge my colleagues to to look kindly on the application of the applicant from District 5.
Yeah, thank you, Commissioner Thompson. I'm just trying to look here. So that is the 24th. You are going to be gone. Okay.
Chair Quila, members of the board, if I could chime
Yes, County Manager.
Commissioner Thompson is correct that we do have one applicant from District 5. And if you recall, there was a number of applicants from District 3 that are part of the incorporated area. And since there's a limit on the number of folks that can be from the incorporated area, a decision for the board will be if you want to interview all applicants or just those that are not part of the incorporated area. And if you are interested in having geographic diversity, then probably limiting applicants to District 5. And I think District 1 also doesn't have a planning commission member right now. So to the 24th, we set aside 30 minutes, but I'm just letting your board know that it could be a shorter interview process, depending on how the board might want to handle that.
Well, I don't want to speak for everyone and people can weigh in. I think we do want to see the geographic diversity. That was the reason that we went back out and looked for additional applicants. I'm sorry that no one from District 1 has applied because it would be good to have someone from District 1 on there as well. But I don't want to waste people's time if we're not going to be in compliance with what our own rules are about where these folks are representing in unincorporated and incorporated areas of the county. Then maybe we do tell those that have applied from District 3 that we are looking for that diversity. We want folks from District 5 and District 1 so that we can have a balanced board. And then we don't have, everyone coming to interview knowing that that's kind of our parameters. But I'll let the rest of the commission weigh in. That agreement, Commissioner Thompson, Commissioner Wakua, Commissioner Thompson?
I was just waiting for Commissioner Wakuya. My rule in speaking is if everybody hasn't had a first bite at the apple, I wait to take my second bite till somebody else gets to speak. But I do feel quite passionately about this. As I said, it is over half the landmass of the county. I do wish there was someone from District 1, but I agree with your proposal. Let's not waste people's time. They're well qualified. They're good people. I wish we could find another way for them to be involved in a volunteer capacity with county government. But in the meantime, I would like to have a planning commission member from District 5.
Yeah, thank you. Commissioner Wakua?
Commissioner Thompson was very eloquent in the way she worded that, and I concur.
Okay, thank you. I think that's the direction. Then we'll just go ahead and invite applicants to participate in the interview that might be from District 5 or District 1. Yeah.
Which, just to confirm, board members, that'll probably be one applicant.
One person.
So,
okay.
thank you.
Okay. Very good. Anything else on the agenda? All right, we'll go ahead and move on to the OHCS shelter rehousing funding, and Alyssa Gertler is Or oh, there she is, Mrs. Gertler, our housing manager. Welcome.
Chair Quila, I am actually gonna present some slides and then Alyssa will
Okay.
be chiming in as well. Can you all see the slides that I have up on the screen? Great.
Yes, we can.
So
Thank you, Monica.
yeah, no problem. Thank you. For the record, Monica Steele, Assistant County Manager. Thank you, Chair and Commissioners. What I wanted to start with is just a recap of the 23-25 OHCS funding that primarily came through the emergency order in House Bill 5019. And so to recap, what we were able to accomplish in that biennium was we created 95 shelter beds, 80 of which were funded through these OHCS dollars. And that was our goal, was 80 established by the state. And then, so being able to exceed that to 95 with the addition of the Esperanza Village through efforts that CCA found other funding for really helped from a county-wide perspective. What we also had was a goal of 42 households to be rehoused. And as you can see, we accomplished 223 households being rehoused, which far exceeded that number. In addition, we were tasked with distributing funds for the harbor and Helping Hands as well for existing beds that were already in place in the county. The harbor has beds throughout the county to serve the domestic violence population or those suffering from domestic violence. And then Helping Hands has shelters in both Seaside and Astoria. And so the work that was accomplished was phenomenal by all of our partner agencies, Lifeboat Services, Clatsop Community Action, as mentioned, the Harbor and Helping Hands. And so we're very proud of everything that we were able to get done this last biennium. Now the work begins for this next biennium, which, if I can, whoops, move my slides slowly, is being done with less. And so this next biennium, we are receiving $1.8 million, $1,826,531 to be exact. And this is around a 7% reduction in funding, and this is being distributed to those same 4 providers. In addition, we are being required with this reduction in funding to maintain all beds. And so that doesn't just include the 80 beds that we created, but it includes the beds that were being funded for the harbor and Helping Hands. And so in total, we have 163 beds that we have to maintain. And these beds, a new requirement of them is that these beds at this point in time per the contract must be made available through the day and night and must be open 7 days a week, which is a variance from the prior biennium funding requirements. There's also some additional funding changes. So none of these dollars, these are specific to shelter dollars. None of these dollars can be used for street outreach or housing focused activities. And these dollars are limited in the capacity building to 15%. In the prior biennium, that was not limited, and that was primarily because obviously we were trying to create beds, and so capacity building was a big focus. Now the focus is on maintaining these beds, and so that's why the capacity building amount has been limited. In addition, there is the admin costs, and so the county also retains a portion of these funds for the administrative oversight of Alyssa and myself over these 4 grants or these 4 providers. And then additionally, each of these 4 providers is also able to receive admin costs as well. So at this point in time, we are still waiting for our finalized contract from OHCS for this biennium. We know that all of our providers are also patiently waiting because many of them, their funding obviously ran out June 30th. And so they have been getting by these last couple of months, either with their reserves or other creative funding streams. And so we're eager to get this process with OHCS completed. The other piece of this is we're still waiting for what was previously called the Rapid Rehousing Funding or ORI funding. We are waiting on what that amount will look like. We are supposed to be receiving a draft contract for review in October. We did learn from CCA that some of the individuals who were rehoused with these monies received notice that their funding is running out effective October 1st. And so it is unfortunate that these dollars are no longer available, but we are hoping to be able to get additional funds through this long-term rental assistance program. But again, the timing is essential, and we're still waiting on that contract to come through. The last thing I'll say is that Alyssa attended a rulemaking session yesterday regarding these shelter funds. And so there are still a lot of questions and concerns that aren't just coming from the county, but other counties throughout the state. You know, the contract is very clear that we are to maintain the beds that 163 beds. However, you know, it's a reduction in funding. And so we're asking our providers to do basically more with less, and being a little bit concerned in some of the wording of the OHCS contract that says that we must do this. And then also just some language regarding no notification dates should send funding potentially cease. And so we're still waiting to hear back from OHCS and hope to have more information before the end of the week. Alyssa, did you want to provide any additional comment before we open it up to you all for questions?
Thank you, County Manager Steele. Just a quick sort of high level context. Most of you know 2 years ago, our homelessness efforts started as a Clatsop County, thanks to the emergency order of the governor, and thanks to your efforts in getting us included in the governor's emergency order. As Monica mentioned, we've now spent 2 years building basically a countywide homelessness system. This past legislative session, House Bill 3644 passed, which was essentially the state converting the emergency orders into a statewide shelter system and rehousing program. And really, I think all of Monica's comments just speak to the fact that we're working on a countywide issue that's being essentially funded and led by the governor, the legislature, and Oregon Housing and Community Services. So we're working with these large state entities to try to deliver at a local level. And it's been challenging to work with the resources we've had and the sort of changing playing field and rules. And so we should only be more proud of the work of our providers and of all of us working in partnership. One of the things that Clatsop County does well, what we lack in resources, we make up for in our partnerships. And our MAC group has worked incredibly well together to leverage these resources to go as far as they possibly can. And that is our goal for the next 2 years, despite some of the new requirements and challenges. So just wanted to put out that we should be proud of our efforts and look forward to hopefully doing more with less over the next 2 years. Thank you.
Thanks, Alyssa. So any questions?
Well, yeah, I appreciate the update and thanks to both of you for the efforts. And I think you've outlined exactly the journey over the last 2 years. We've been successful in trying to do more with less, and now we're being asked to do with even less. And it is frustrating because you see those resources going elsewhere when we've actually been effective in utilizing. So do we have any comments, questions from team here? Commissioner Thompson?
Thank you, Mr. Chair. Well, again, thank you, staff, for the informative presentation. I spent the weekend listening to the legislators listen to community members talking about transportation, talking about the burden on taxpayers, talking about the need, as you've said, to do more with less. This is going to be present in every single state agency program. The question is, are we respected partners with the state agencies, with the governor, with the legislature? I again ask for their partnership, for our collaboration, the solid efforts that you've made to deliver services with the strong relationships and partners we have all over Clatsop County is golden. Because when I'm in those venues speaking to collaborate with us, cities, counties, state agencies, and the legislature, that is what will be required so that we can flatten the administrative burden, so that we can reduce, what do I want to say, red tape. I mean, that's an easy thing for people to understand. We want to be accountable for our results. We want to use those resources well. We are determined to address the needs of the people in our community. If we keep saying that and we keep doing that, it gives me hope. But it's a struggle because those federal and state resources are strongly, I would say they're on a trend that doesn't inspire anything but consternation right now, at least in from where I sit. So well done. This struggle will continue across every program, but housing is so important. Thank you. Bye.
Thank you, Commissioner Thompson. Any other comments from the commission? Again, we really do appreciate what has been done to this point. I mean, this is, yeah, it's hard to believe it's only 2 years ago. It seems like it was long ago, much longer ago, that we had to fight tooth and nail to try to get into the emergency order. And it was a real accomplishment to do so. We've done exactly what was asked of us. And now we're just kind of, again, at the mercy of funding, and we'll just have to see if we can continue to advocate for ourselves. And again, we're going to continue this good work regardless. So I do appreciate it.
Thank you, Chair.
Next is the opioid settlement funding on page 4. And Monica, is this you again?
This is me again.
Assistant County Manager Monica Steele.
Thank you, Chair, Commissioners. So as you're all aware, several years ago, back in 2021, the state of Oregon began reaching settlement agreements regarding the national opioid crisis that Oregon has been impacted, as well as Clatsop County being impacted by. And so part of those settlement funding agreements was that there would be this distribution with 55 or 45% going to the state, and then 55% going to various local jurisdictions. Clatsop County, signed into this, and we are a recipient of those settlement funds. And then also the city of Astoria, because they are a city with a population of over 10,000, they also got an allocation. Since prevention and treatment work isn't really in the city's wheelhouse, they opted to pass those funds over to us. And so we receive our portion as well as the city of Astoria's portion. And so we've been receiving those funds for the last few years, and really trying to get community input, your board's strategic plan, trying to figure out, similar to what we did with the ARPA dollars, what is the best, highest and best use of these funds. Some of these settlement payments came in one-time amounts, and then some of them have set up annual distributions. And so in some instances, the payments are anticipated to occur over the next 20 plus years. And so still trying to figure out, because there continue to be a lot of settlement agreements taking place. So still trying to figure out what that annual amount is going to look like versus what, you know, the amount that we've already collected is. Because when we are trying to do something long-term from a programming perspective, we want to make sure that we have the annual amounts available to be able to continue to support the services that we're providing. So we've been doing a lot of outreach, have heard you all through the strategic planning process. And one of the things that continues to come to the top of the conversation is our youth and the concerns around youth prevention, youth treatment, and youth mental health. And so last September, we participated with the help of Gobi in a youth sim. And I've included that in your packet as far as the final report from that. And we had about 30 different agencies that work with the youth population. And that varied from the schools, DHS, the hospitals, law enforcement, the juvenile department, the harbor, CCA, a variety of the Parks and Recs departments, a variety of different groups to try and get input from them as well. And then following that youth sim, we then began to have several meetings with the superintendents of all 5 school districts. And one of the recurring themes that we were hearing from them is that unfortunately, it's not just about prevention for our youth, but we have a large number of our youth population that need treatment services. And so working with CBH, Kelly Broughton from Health and Human Services and myself, we had a number of meetings with those superintendents as well as some of their counselors and their teachers, and have had very good conversations with Clatsop Behavioral Health Care, who we will be bringing before your board a contract to provide counseling or CADC, counseling, alcohol, and certified alcohol and drug counseling services. Sorry, too many acronyms. As well as peer mentor. And these positions would be going into the schools, similar to how their mental health counselors currently do, and they would be rotating. We have had great conversations with the Astoria School District so far, who are ready to implement this, because one of the other pieces that we have to figure out when doing this is a space for where these counselors and peer mentors will be able to be housed. We're also, you know, in the conversations with all the school districts, trying to figure out what the need is going to be. And so kicking this school year off, that's the best way to start getting some of those referrals is teachers seeing those youth every day, having interactions with them, and identifying what some of those concerns might be. And so we will be working on that with CBH. We also look forward to the results from what our health department sent out, which was some surveys to try and hear not just from the youth, but also from the teaching staff, the different educators, what their needs are around prevention and treatment. And so being able to understand, are they needing our prevention assistance with curriculum? Are they needing us to come in and help provide prevention education classes? Are they needing us to provide education classes for the parents? And so we hope to have that information in the next month, that final report, and then we'll be bringing back something in the future to your board, focused more on the prevention side of things, not just the treatment side of things. Another area that we will be looking to contract with CCA on is the homeless liaison outreach. And so a lot of our individuals who are suffering from opioid addiction are some of those individuals who are living out on the streets and have co-occurring illnesses. And so being able to have that liaison position countywide who can go out and have those interactions, we know that oftentimes, you know, that first interaction, you're not going to be able to get somebody to make a choice to try and make some changes in their life. But building those relationships and being able to see that individual coming and talking to you, then once those relationships are formed, hopefully those individuals will be more engaged in trying to get some treatment and counseling themselves. So those are some of the things that we have in the works and will be bringing before your board. Some of the other stuff that we have done this last year, we did use some of this funding to help offset some costs with the MAT program in the jail, the medically assisted treatment program. And so we will continue to work with the sheriff and his team around if there are needs there as well to serve the adult population. So just wanted to provide you all with an update on that as to some of the contracts that you'll be seeing come before you and some of the work that's being done, and ask if there are any questions.
Well, thank you very much, Monica. And certainly, this is the priority for our commission, was the youth, and I'm glad that that's what we're targeting and focusing on. I was curious, was the Rural Health Coalition, were they involved as a stakeholder or one of the community partners when you were having these initial kind of discussions, or what is their role?
So the Rural Health Coalition there were members from that at the Youth Sim. And CBH is a member of the Rural Health Coalition as well as the Clatsop County Health Department. We've also been having conversations with them around these dollars, around the transportation aspect. That still is kind of an ongoing conversation. There's been a lot of different challenges there. And so those are conversations that are occurring, not specifically Rural Health Coalition serving the youth population, but more focusing on the transportation aspect.
Oh, that's great. Yeah, thank you. Do we have any comments or questions? Commissioner Thompson?
Thank you, Mr. Chair. This is all very good work, and I fully support addressing youth. I'm curious about the role of Columbia Pacific CCO. They have access to millions of dollars in public funds. Are they at the table? Are they helping us? You'll remember that Clatsop County doesn't have a representative on that board. Commissioner Scar is there from Tillamook County, but nobody from Columbia County, nobody from Clatsop County. Curious.
So these are not conversations that we're having with the CPCCO because these are funds that are Clatsop County funds. And so if there are opportunities where there can be matching grant opportunities, I know that CBH has applied for some grant funds to try and, hire an additional position to supplement the two positions that we're looking at in this first year. But we've been focusing on how the Clatsop County community wants to spend these dollars, and we haven't engaged with the CPCCO on these specific dollars.
Just saying, they got a bunch of money. I'd like to see us have some voice in addressing our unmet needs, given the financial constraints that everyone operates under. Thank you.
Thanks.
Yeah, thank you, Commissioner Thompson. I'll note that I think Care Oregon and the CPCCO are also receiving some funding constraints or some issues with their funding stream as well. Anything else that we want to talk about here? I appreciate Kelly Broughton and appreciate the report here, or at least the Youth Sequential Intercept Model Mapping Workshop report. That was very comprehensive and good information.
Thank you.
Anything else? Okay, well, we don't have any other items on the agenda. I know that there's going to be a floodplain protection meeting at 3 o'clock today to get the latest with the EIS and the lawsuit and all of the things that they've been advocating for counties, cities, and others within floodplain. All right, and I just wanted to note that I know Commissioner Bangs her husband was getting sent off to a fire, so she couldn't be here, and Commissioner Webb also had a conflict today. So, appreciate Commissioner Waku and Commissioner Thompson being here. And okay, well, we'll go ahead.